morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. Well, it just still doesn't seem like it's the new year and we're already to the middle of January. I still feel like I was getting ready for the annual election period back in September, waiting for October to show up, and now we're in the middle of January. It is 2026. Yes, the other thing is, if you waited and didn't do anything to update your healthcare marketplace plans, it's probably too late to do that. And I say probably because as I'm recording this, we have passed the January 15th deadline to set up either a change or enrollment for a February 1st on the healthcare marketplace, also known as Obamacare or the ACA Affordable Care Act. Congress is still debating on the subsidies. The House did pass a bill. It's been sent to the Senate, and I know just a day or two ago I was looking at something and talking about another bill that was passed in the House. In the Senate didn't meet that day at all. So I don't know if anything's going to happen there. I've heard there's a couple different debates on a 2-year extension, on a 3-year extension. But if you don't have anything set up on the marketplace right now, I don't know that extension is going to make much difference to you if you didn't renew this year because of losing the tax credits. They may set up a special enrollment for those that didn't get to take advantage of that, or they may have some sort of, if they do extend the tax credits, they might give us some way to go ahead and update, your edit your application and update and get those tax credits put in place. One of the things that probably will happen, even if they do that, is what has worked with some of my clients who have contacted me after December 15th or after the first of the year even and said, hey, I've got a bill. They say they want $1,800. They want $2,150 for my health insurance, and it was only $80 last year or whatever it was. Well, it's because either I've had it happen to a couple of clients that they had just kind of let things roll over from the year before. And the problem is you do have to have a minimum income to get that tax credit. I know I've mentioned that here before, but you have to be above 100% of the poverty line as the government sets that number. And this year, I think it's like 15,800, maybe. But generally, if you put if you estimate your single person, you estimate your income at 16,000, then you will qualify for a tax credit. Well, I had an individual that had done it. We set him up 2 years ago, and he estimated his net income at 14,000 something, which was enough for the tax credit 2 years ago. And so when it auto renewed, he was no longer eligible for the tax credit. So we were able to edit his application and get it up to date, and now he's, paying something he can afford in February, but he's going to have to pay that full premium. And I've had a couple clients that I've ran into that, and what happens there is if they want to stay with the company they're with, they're going to have to pay that full premium for the month they didn't get the tax credit. Now, of course, that will all reconcile out when you file your taxes, but that's not this April. That's next April, because you're filing your taxes to reconcile the tax credit you're receiving this year in 2026. So filing your 2025 income tax isn't going to help you with that. But, and again, also, sometimes you have to submit some proof of your income because of changing your income status or whatever. If you did an application here in the last week, last month or so, and the marketplace gave you a 90-day grace period to get that paperwork in. So if you're just waiting to get your 2025 taxes filed, then I would try to get that in early. I know because I did client I worked with this week. It was an April deadline for him to get that updated. So, before the tax deadline. So if you're getting ready to file your 2025 taxes, get that done. If you haven't done 2024 and you're doing marketplace, please do that as soon as possible. It's frustrating for me when I get people say, hey, they took my health insurance went up, $1,500 or $2,000. And it's like, I can't, the old horse to water, cliche. I can't make people file their taxes. But the IRS in the marketplace will say you don't file your taxes, we will take away that tax credit, because that's what it is. That subsidy that helps you pay. I mean, everybody calls them subsidies, which they are. They subsidize your monthly premium, but they are a tax credit. And again, the name for it, APTC, Advanced Premium Tax Credit. The marketplace issues you that tax credit, but technically it's the IRS advancing it. So they're advancing that tax credit to be applied to your premium. That's why it's advanced premium. And then that reduces the net amount you have to spend. It doesn't really lower your premium. It just lowers how much you're having to come up with. But if you don't take care of the tax filing paperwork you need to, you lose the eligibility for that tax credit, and they will take that back at tax time. And a lot of people want to call it a penalty. It's not actually a penalty. It is a tax. You got a tax credit. If you're no longer eligible for the tax credit, the IRS says you owe that money back. Now, if you don't pay that money when you file your taxes, yes, you can have a penalty for not paying your taxes. You can have interest added on to it, so it makes it even worse. So the best thing is to keep things up to date so that you know your tax credits are deserved and you don't have to worry about losing them. The other thing I always caution the folks, when you're on the upper end of the income, because if they don't extend the tax credits, you have to be very careful that your income doesn't go over that cap. And this year, it seems to be that cap seems to be $84,000 for a couple. And I forgot, I mentioned recent show, I was going to double check to see what it is for a single person. But I know I put in somebody, I was working with somebody yesterday, and we had put in $50,000 of a single person, and he was still eligible for a tax credit at $50,000. I think it was about $300 a month. So if you're single and your income is $50,000 or lower, yes, you should qualify. I should have double checked to see where he cut off on that, where he would no longer be eligible. We ended up going with a lower estimate on his income anyway. The issue is, and he was ready and said, hey, I know I'd rather, pay less now and just knowing I have to catch it up when to come tax time. So that probably was the right way to go. But what worries me is those folks that are close to that $84,000 as a couple. And of course, they're getting up in the years. Usually, when those are the people I'm talking to, they're usually in their, their early 60s. They're thinking about retirement. They're thinking about maybe starting their Social Security and all those little things. I had somebody do that, and I still don't understand why. Decided to start drawing their Social Security, which now raised their income, so they were ended up getting close to $400 or $500 less of tax credit for their health care. So they're losing, $400 or $500 of their Social Security due to it going to their health care premium. I try to caution, but if you're drawing the subsidy for the marketplace and you're close to actually getting close to that, that max amount, don't start your Social Security yet. Wait until, at least wait till you're 65. When you're going on Medicare, then you can start drawing your Social Security because you're not worrying about your health insurance subsidy. You're not gaining. It's kind of like that, if you're working, if you're 62 but you're still working, maybe part-time, or maybe you go to part-time and say, I'm going to start drawing my Social Security. Well, you've got to be careful. I think we're up to about $23,000, it's $23,000 that you can earn before it would affect you drawing your Social Security, if you're drawing your Social Security before your full retirement age, which today is now 67. If you earn over that $22,000 or $23,000 cap, for every $2 above that threshold that you earn, you lose $1 of Social Security. So if you're going to work, be very careful if you think you're going to get ahead also drawing your Social Security prior to age 67. So, and that's just, I'm not a Social Security expert, but that's some of the things I've run into and seen that affect my clients. So that's why I wanted to get that out there. But speaking of taxes, one of the things I wanted to get out to everybody is I was checking on somebody's account, and I noticed when I looked into what's called Health Sherpa, the tool we use to help people get enrolled in the healthcare marketplace, that their 2025 1095 was available. So if you're wanting to try to get your income tax filed early, maybe your employer gets your W-2 to you early, or your 1099, or you're self-employed, you want to get ahead of the tax schedule, you can get that 1095A and at least have that or at least have it, kind of in your. I know my wife and I, we have like a big envelope and all, that what I should say, envelope folder, and we put different envelopes in that for, okay, here's the 1099s we've got, here's the envelope that's got the receipts for my business expenses, all those little things. We keep all that stuff together, so we got a nice, neat package of all our tax stuff for the year. So if you want to get ahead of the game, that's one of the things you want to do. And that is something I want to put out as a service to offer to my listeners. You don't have to be a Matt Libby insurance client for us to be able to help you get that 1095 instead of you just waiting for it to get in the mail. We can go ahead and put into the system, into our Health Sherpa system, and download that for you. You can come by the office and request that, and we can print it out for you right there, or you can email us and we can download it and email it to you. The only thing that I ask for you, the one thing we will have to have is we do have to have a written consent to access your healthcare marketplace account, and we have a link where we can send you that CMS consent form, and you just fill in a couple blocks on it to put, print your name and then put in an electronic signature. And you don't have to print that out or anything. If you request our assistance, we can send you the link for that and then send that to you, and then turn around and put you into the system for Health Sherpa, so we can download your marketplace account and then get that 1095 for you and then send it to you. And just to let you know, security wise, basically all I need to know is your name and your date of birth. And I can put your information there, send it. And the form that we get will not have your full Social Security number on it. So I don't want you to feel like, oh, I'm going to give him that information, he's going to go get my Social Security number. No, it'll show like your last four, but it won't show your whole Social Security number when we access your marketplace account. It will show us, what subsidy you're getting and what plan you have. And like I said, you don't have to share that with us, but if you want our help, that's information that we will have access to. We're not going to push you to, you got to buy this or buy that. You do not have to, like I said, you do not have to be a client if you just want us to help you get that form so you can get going on your taxes. And our existing clients too, if you're listening here and you are one of our clients, just you can say, hey, can you send me my 1095? It's real simple for us to go and get that and email it to you. So it's not a big deal to get that for you. And like I said, if you want it printed out, just let us know, and then come by the office and pick it up. Just doing that as a basically a community service, not just a customer service. So we can help you get going on your taxes. But it also, that lets me know that, hey, you are actually listening to this show, and I can help you. It's one way for us to know that we're helping you. And also the flip side on that, please go to Matt Libby, or go to Google, or you can go to my, Matt Libby Insurance Facebook page, leave us a review. You can go to, and then of course, if you go to insurancematchmaking.com, there's the links for the YouTube recordings of the previous shows. You can go back all the way back to my very first show, back when it was not Grace 107.7, it was News Talk 107 WHUB. WHUB is still the call letters for the station, but the format has changed if you're a new listener. As they say, share the love. We really appreciate, especially those 5-star reviews, and that's helped our business a lot this year. So many people that have come to the office have said, we ask how they found us. Did somebody refer you? Did you find us on the web? And most of them are saying they just Googled, they found it, and they said, hey, and you had all 5-star reviews. That's why we called you. And doesn't hurt the fact to be local. So, a lot of people want to be able to sit down with the person they're working with, not just do it over the phone. And I totally appreciate that. And we can do both. So anyway, we're up on the break here for the commercials, and I'll be back in a minute.
It's a new year, and it's time to drop old habits like slow internet and bad cell service. Make 2026 a year for better connections with Tri-Lite. Get gig speed connectivity at home and crystal clear wireless wherever you roam, all backed by the friendly and local Tri-Lite team. Bundle to save and start the new year right with Tri-Lite. Better internet, better wireless, better year. To learn more, call 833-847-0824 or visit trilite.net.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back to Insurance Matchmaking. I had to take that commercial break there. And I was talking about just, before the break, yes, we really appreciate if you can, go online, whether it's Facebook or Google. I did sign up for a Yelp account. I don't know if that's going to ever do me any good or not, but it's there. And just please leave us a review. If you have a problem with us, please reach out to us first. See if we can't rectify that, rather than putting us on blast on the internet. Fortunately, I haven't had to deal with that, but I'm sure I will someday or another, that somebody will give me a negative review. So I actually came close to doing that. I was doing the old death scroll, as they call it, surfing on the internet, and saw a comment. Somebody made a really bombastic statement about minimum wage, and I answered in what I thought was a fairly intelligent, cogent comment, and was getting blasted immediately that, I just want to take advantage of my employees because I only want to pay them minimum wage, which I never said I wanted to pay them minimum wage. I just have I had an objection to how they were portraying people who are fighting raising the minimum wage and things like that, because it was talking about, the employers just want to take advantage of their employees, and which is, I took exception to that, but making the comment, they took it that I wanted to take advantage of my employees and not pay them a fair wage, which I don't think is the case. I guess you'd have to talk to my employees to see what they say about that, but I think I pay a fair wage for our market here, and it's not minimum wage, I will tell you that. But I wasn't realize I was signed into my business page on Facebook, so immediately I had people commenting on my business page and tagging my business in the comments because they wanted to put me on blast because I'm such a terrible, tyrant as an employer. Versus if I'd have just done it on my personal one, they probably would just chalk it up. Oh, here's somebody else. Here's another one of those MAGA guys, and it's like, yeah, I'm MAGA, but I'm not MAGA I don't wear the red hat everywhere. And I'm not a blind sycophant or sycophant, I guess is the right pronunciation, for President Trump, but I do support many of the things that he's doing. I do believe in, Make America Great Again. I do believe America first. That's part of the reason why I served for 20 years in the U.S. Army. I served to fight socialism, and I'm sorry if I'm offending you right now, but I hate to see some of the things that's going on in our country that I thought I was serving to prevent being a part of our lives. So sorry, I didn't mean to go down a big rabbit hole there when it comes to politics. But yes, like I said, I started out on a very right-leaning radio station talk show, and now I'm on a Christian radio station. And yes, I lean conservative in both of those realms. I am definitely right of center. So if that offends you and you don't want to work with me because of that, I'm sorry. I do try to keep politics out of the discussion when I'm trying to be informative and talking about and relaying facts and stay out of the emotional part of it and just talk about the facts. And like I said, on the expanded tax credits, I loved the fact that people weren't hitting that 400% cap. That's one of the things I hated about the way they did the tax credits for the Affordable Care Act, that you had people, because I've had this happen to people. They were at the upper end, and they made the mistake of taking some funds out of some qualified funds to pay for some other things out of their, like an IRA or a 401k. Well, that money is now taxable income when you take it out, and it pushed them over that 400% threshold. And so now they didn't qualify for any tax credit. And of course, they didn't find that out till like about March when they were talking to their accountant to file their taxes. And so it hit them in 2 years because they had to take out extra money now to pay their taxes. So I like the fact that when they increased that the 400% cap was gone, so the people, they ended up having higher income than they estimated. Yes, they owed tax credit back because they now were not entitled to as much tax credit as they were getting, but it wasn't the entire amount. It was a lower amount because, it's a cliff, as we call it. Right now, I've seen it with people where, they're eligible for $2,200 of tax credit as a couple when I put their income in at, say, $70,000. And then they go, oh, no, that's just – because I had that happen this week. Oh, that's just my income. The spouse also had Social Security or a pension, or there was other money coming in. Now put them up over $100,000, and they weren't eligible for any tax credit. So it went from $2,200 to nothing. And that's been my peeve with the way they structured the tax credits. I think they're too generous at 400%. That was the thing I think they could have done differently is the decreasing tax credit from going from the 100% to the 400%, it should have started decreasing at a faster rate. So someone at 390%, instead of qualifying for a $2,000 tax credit, well, maybe they only qualified for $1,500, and then that's somebody at 500% poverty level might be eligible for a $500 tax credit. So they still get some help paying for the insurance, and it's not very affordable, but it's more affordable than having no tax credit. And that's something I think they could have put in the structure. Because my other issue is you shouldn't be paying zero for your health insurance. You should be paying a little bit. I mean, I'm not saying not a lot. I mean, it could be, maybe it should have never gone below $10 a month or below $50 a month for the lowest plan, with tax credit. Everybody needs to have a little bit of, as they say, skin in the game. If you're paying a little bit for your health insurance, you have a little bit more respect for it because hey, I'm not going to waste this because I want to make sure I'm getting it, or I want to make sure I keep up with my taxes because I want to make sure I keep that tax credit. When you're not paying anything for your health insurance, you just think, oh, the government's providing it, I don't have to worry about it. And that's part of the problem. And of course, that was part of the design of the plan. And like I said, I'm leaning into politics now, and I want to stay away from that. But there was a lot of things they could have done when they created the Affordable Care Act that made things affordable. And I think also if the tax credits hadn't been quite so generous, I think the insurance companies maybe wouldn't have raised the rates quite as much as they did. I mean, yes, they have to make money. They have to be able to take into account inflation and healthcare costs and say, okay, we can provide healthcare for these people at this rate because that's what it's going to cost us, especially because they do have to accept those with pre-existing conditions. You can't be turned down for that. That's one of the things of the Affordable Care Act. But the other thing is, hey, you need the healthy people also getting a plan and paying something for it. And I think you would have had a lot more people actually paying into the system if it would have been affordable for everybody and not just affordable for those at low income. And that's what they needed. They needed more healthy people to get it. The tax penalty didn't incentivize people to get it. There's a few people I can remember coming to me for health insurance. I don't want to have a tax penalty. And actually, for the first two or 3 years of the Affordable Care Act, there was no tax penalty assessed. The ruling was there, but they didn't start charging the tax penalty until like year 3 or 4 if you didn't get insurance. And so you had people that decided, well, I'll just wait until they're going to put the tax penalty in and then I'll get insurance. And then even when they did, it was kind of funny. The people that were doing it, and like they were healthy and could have gotten the plans that they do represent that are, you have to qualify health-wise. I have people that could qualify for those plans because they are in good health and have something that cover the catastrophic. And the difference between that and if they had the tax penalty for not having the marketplace because they didn't qualify for a subsidy, most people were still ahead because those premiums at that time, I haven't looked at them recently. I realized I hadn't done that to compare, what it costs for someone to get what we call the short-term plans versus what they would pay for a marketplace plan. But when we were doing it and juggling against the tax penalty, it was about 50%. Say you were going to have a $1,100, was a low cost marketplace plan. You could go with a short-term plan with virtually about the same deductible and say maybe it was $600. So you're paying $600 instead of $1,100. $550 is halfway on $1,100, but just kind of, what I'm saying, you're paying a little bit more than half for the other plan, and you have health insurance. And again, it goes back to you had insurance. A lot of people confuse the term in health insurance and health care, and they've become synonymous. Health care pays for the going to the doctor, you have a copay, it's helping you pay for those services. You don't have to pay for an x-ray, or you pay a $50, again, copay for an x-ray versus paying the full price for the x-ray because you don't have a health care plan. Health insurance If you look at it purely as insurance, sometimes called catastrophic plans, you have a high deductible because you're going to pay the first bit of the cost. But once you hit that deductible, and then sometimes you have some co-insurance after the deductible towards the max out-of-pocket, and a lot of times that deductible is also the maximum out-of-pocket. And I'll just use $10,000 as an example. So when you hit that $10,000 mark, you don't pay any more for your health care for that year because you've hit the max out-of-pocket. There's no more deductible. There's no more co-insurance. There's no more co-pays for your health care or your prescriptions until January 1st. Now, January 1st, that all resets. So if you've got a catastrophic issue going on like cancer, it's going to carry over the next year. You're going to have to pay that $10,000 again because you're probably going to have those expenses. And that's one of the reasons why we recommend that you consider a lump sum, some type of critical illness plan that will pay if you have cancer, a heart attack, or stroke. It'll pay you a lump sum. So now you know you can pay for your health care, hit that max out of pocket, and then have your insurance cover the rest. So those are some of the things on that. One of the things I did want to mention, we do have plans called Affordable Choice. I think they use, I don't know if that name existed before the Affordable Care Act, but it is a fixed benefit plan, and I've had a lot of people look at it because it'll pay so much for a doctor visit, so much for a surgery, so much for an x-ray, so much for prescriptions, and it's much less than going through the healthcare marketplace. Now, you do have to pass health underwriting to get the plan, so it's not great for everybody. But one of the things I did like about it is they will diabetes is not a knockout, as we call it. You could still qualify for this plan and have diabetes. The short-term plans, if you have been diagnosed with diabetes, even if it's, and I know a lot of people say, well, look, the doc says I'm pre-diabetic. I've got this, I'm taking this little sugar pill. The insurance company at that point, you are diabetic and they are not going to cover you. But the Affordable Choice plan will cover you there as long as there's not other related underlying conditions going along with that diabetes diagnosis. So, diagnosis. I said notice. So that's something we can help you out with. And again, the short-term plans, the fixed indemnity plan, there is not an enrollment period for those plans. You can apply for that plan and request it to start tomorrow. So if you've missed the enrollment deadline, which that's passed now, it's January 16th, and we can still get you on a short-term plan or the Affordable Choice plan. We can get you critical illness plans, dental plans, all those things. There's no enrollment period. The only enrollment period is for the health insurance, and that's for the Affordable Care Act health or qualified health plans. So coming up on my end time here. So as remember, at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg. Please keep listening to us here on Grace 107.7 and tune in next Saturday at 10 o'clock for Insurance Matchmaking. Until then, have a great week, and I hope to talk to you next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.